Do you get sharp shooting or electrical pain that stops you in your tracks? In this video, I'll unveil 5 sneaky culprits behind shooting leg pain, including some you may not think of. Learn how to tell the difference between them, plus tips and exercises to finally get relief. Let's get started. When many people have shooting leg pain, they'll describe it to their doctor as pain that radiates from their hip down their legs. Now, this will often lead to a hip x-ray. And if you're over 50, like many of my patients or viewers on YouTube, it's very likely that you may have some hip arthritis. But this can often lead to a wild goose chase, implicating the hip arthritis on the x-ray as the cause of your shooting pain down your leg. Now, hip arthritis can cause shooting pain down the leg, but when it does, it often causes shooting pain down the front or down the inside of the thigh. But it's much more common that people experience shooting pain down the outside of their leg or down the back of their leg, which is not commonly caused by hip arthritis. So it's very important that you're accurate and very specific with the location of your symptoms when you're describing them to your doctor. This can help lead to a better diagnosis. Now, if you do have shooting pain down the front of your leg or down the inside of your leg and it's coming from hip arthritis, I've got another video that shows 5 of the best exercises for hip arthritis, and I'll link to it in the cards as well as the description down below this video. But hip arthritis isn't the most common cause of shooting pain down the leg. The most common cause of shooting pain down the leg is a pinched nerve in your lower back. Now, depending on the level that the nerve is pinched at, it can cause shooting pain down the front of your leg, down the side of your leg, or down the back of your leg. The L2, L3, and L4 nerve roots will shoot pain down the front of your leg. The L5 nerve root often shoots pain down the outer leg, and the S1 and S2 nerve roots down the back of the leg, but much more commonly the S1 nerve root. If you have a pinched nerve in your back, it's quite likely that you may experience other symptoms as well, such as numbness or tingling in your legs. Now, if you experience weakness, for example, your leg giving out on you, or especially if you notice a change in your bowel or bladder functions, for example, an inability to control it, it's very urgent that you see your doctor immediately because those are more serious concerns. If the pinched nerve is coming from your lower back, it's also likely that either positions of your spine or movements of your spine will change the symptoms, either make them better or make them worse. For example, bending forwards, bending backwards, or bending side to side may vary your symptoms. Now, if you're over 50 or you have some degenerative disc disease or possibly spinal stenosis, it's much more likely that extension positions or backward bending positions of your spine are more likely to pinch the nerves and cause an increase in your symptoms. That may mean standing for long periods of time or walking for long periods of time. It may mean backward bending movements or bending towards the side of the symptoms may also increase the pain. And so one of the best things to do if you do have a pinched nerve in your lower back and it's being caused by one of those problems is doing the opposite movement. So in the case of pinched nerves that are being aggravated by extension or backward bending of your spine, just doing forward bending movements can help. For example, forward bending in standing, rocking back on all fours, pulling one knee or both knees up to your chest, or one of my favorites and most practical ones, just bending forwards from a seated position. All of those movements can help open up the spaces where the nerve roots come out of your lower back and can help relieve shooting pain in your leg if it is coming from the lower back. Now, another cause of shooting pain down your leg can be a peripheral nerve compression. And the most common one is the sciatic nerve down the back of your leg, which is made of the L4, L5, S1, and S2 nerve roots. But you can also have a pinched femoral nerve, which runs down the front of your leg. And that's made up of the L2, L3, and L4 nerve roots. Now, the sciatic nerve is much more commonly pinched than the femoral nerve, but neither of them are all that common as compared to when the nerve roots are pinched in the lower back. So I would probably think lower back first and then piriformis syndrome in your hip or a pinched femoral nerve in the front of your leg as a secondary cause. Now, if you do have an irritated sciatic nerve in your buttock, it may hurt to sit more on hard surfaces or hurt if you're sitting with more pressure on one butt cheek than the other. If you have an SI joint dysfunction, for example, the joints in your pelvis, you may notice pain right in the small of your back, and that can cause your piriformis muscle, a muscle in the back of your hip, to spasm up and create some more tension on the sciatic nerve. However, the opposite problem is also possible. The piriformis muscle can be chronically over-lengthened and weak, and that overstretching of the piriformis can also cause sciatic nerve problems. And so you want to determine, do you have a muscle that's too short or a muscle that's too long? And one test to do that is just crossing a leg over like this and noticing how far down you can drop your knee. This is a piriformis stretch going down like this. Now, if you notice that you can't get your knee down anywhere close to parallel to the floor, if it's really high up, then it may be limited. Compare it to your non-symptomatic side, if both sides aren't hurting, and note if there's a difference. And if you can get the non-symptomatic side down farther than the symptomatic side, then you may need to stretch the symptomatic side some. If you notice that you can get this one down very far, but it hurts, and this one is more limited, then chances are you probably need to strengthen the muscle. So to stretch the muscle, if it's shortened, you can just sit in a chair and stretch it like this, with your knee crossed over and just putting a little bit of pressure down like that. If the muscle is lengthened, you probably need to work on more strengthening exercises for your hip. For example, standing on one leg and balancing, trying to clench your glute muscles, or lying down on your side and doing a clamshell. Those are all exercises that strengthen your hip rotators, one of which is the piriformis. Now, if you have a pinched femoral nerve, the nerve that runs down the front of the thigh, that's much less common, but it does happen. It can happen after a hip fracture or other trauma to your hip joint. It can happen after a hip surgery, or it can happen if you're chronically sitting in positions where your knee is flexed up beyond 90 degrees. Or if you wear tight belts that put a lot of compression around your pelvis, that can also put compression on your femoral nerve. So you want to make sure that you remove sources of possible compression like tight belts. If you're sitting, sit with a slightly greater than 90-degree angle so you're not compressing the femoral nerve too much in the front. And additionally, doing hip flexor stretches, for example, kneeling on one knee and pushing forward so you stretch the front of your leg, can help. Doing nerve glide exercises is also helpful in the case of sciatic nerve problems or femoral nerve problems. For a sciatic nerve, kind of slouching over like this and just bringing your leg back and forth within the range that you can comfortably is a good way to get your nerves moving. But this should be comfortable. This is not a no pain, no gain type of exercise. Now for your femoral nerve, you can also do a nerve gliding exercise, which is typically more often done in a laying down position, where you lay on the floor and bend one knee up, again, just going in the range that you can comfortably. That helps get the femoral nerve moving a little bit better. Now the fourth cause of shooting pain down the leg is actually a fairly common one, but one that's often overlooked, and that's muscular pain. The gluteus medius and gluteus minimus muscles in the outside of your hip can cause a referred pain that can go all the way down to the knee or potentially even down to the lower leg. Now this pattern mimics the nerve root referral pattern of the L5 nerve. So it's often misdiagnosed as an L5 nerve problem. It can also be misdiagnosed if it just goes in this area right here as hip bursitis. Now, if you do have a gluteus medius or gluteus minimus problem, that's often from those muscles being chronically overstretched over the outside of the hip when you're walking. So it is important to strengthen those muscles so that your hip's not dropping out to the side and bumping into the tendons of those muscles every time you take a step. In the short term, you may need to offload by using a cane or a walker in order to take some pressure off of those tendons so they can recover. But in the long term, you want to strengthen the tendons so that your hip muscles get stronger and you don't keep irritating those. One great way to do that is just to practice balancing on one leg and trying to keep your pelvis level where it's not dropping down to the side. If you're not really great at balance, then hold on to something initially when you're getting started and make sure you can be successful with keeping your pelvis level, which helps strengthen your gluteus medius and minimus muscles. Other treatments that can be really helpful for your gluteus medius and gluteus minimus are manual therapies addressing the knots or trigger points in your hips. For example, myofascial release, manual trigger point therapy, or dry needling, where your therapist takes an acupuncture type needle and puts it directly in the trigger point to deactivate it, can also be helpful and can often provide some quick relief. Now, the last cause of shooting pain in the legs that I'll mention, I'll group these as systemic causes. These include things like diabetic neuropathy or peripheral artery disease, where you don't have good blood flow down in your legs. If your nerves aren't healthy, it can cause shooting pain in your legs. Typically, systemic causes are more often than not in both legs and usually affect the smaller nerves, for example, a stocking distribution down in your lower legs and feet. Now, if you do suspect that you have diabetes, it's a good idea to see your doctor and get your blood sugar and A1C checked. If you have peripheral artery disease, you may notice increasing pain with higher levels of exertion. When your heart has to work harder and it's trying to pump blood to your legs, but it's not getting there, that can cause an increased level of pain, and it often subsides with rest. Now, those are cases that you should not try to manage on your own. In fact, you really shouldn't try to manage any type of shooting pain in your legs on your own, because you want to make sure that you're finding the right cause. And additionally, if you do have pinched nerves in your back or unhealthy nerves from a systemic cause, the longer you let those go on, the harder it becomes to heal and the more likely that you can cause permanent nerve damage. So do reach out to a healthcare professional near you to get the proper guidance. And if you happen to be in the St. Louis area, we'd be happy to help you out here at More for Life. And no matter where you're watching this from, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. And speaking of our future videos, check out our other back and hip pain videos in these playlists right over here. Thanks for watching, and I'll see you in the next video.